Hello and welcome. My name is Chris Rowena, and I'm the lead communications analyst at HCAI Health Workforce. We're so glad you could join us today for the fifth in our series of Rural Health Transformation Program, or RHTP, listening sessions. Today's session is focused on making rural America healthy again. Our aim is to hear directly from you, your needs, your challenges, your ideas, to ensure that California's planning for the RHTP reflects the realities of rural communities. Before we begin, just a few quick notes to help you get the most out of today's session. Number one, this session is hosted on Zoom webinar. Your controls are in the toolbar at the bottom of your screen. Number two, among those controls is the Q&A feature for all of your comments and feedback. Please type your input at any time. Comments will be moderated before they appear publicly. And number three, today's session is being recorded. The recording will be available on our website within 5 business days. Let's talk a little bit about why we're here today. We're here to provide a high-level overview of the program's goals and structure. We're here to share an early survey findings to show how your feedback is informing our approach. And we're here to listen to your thoughts, your experiences, and ideas as we do a topic-specific deep dive. Our commitment to you today is that we're here primarily to listen, not to present. Your feedback will influence how we design this initiative, and this is just the beginning of an ongoing conversation. A couple reminders: as you do provide input and feedback to us, please use that Q&A feature to submit your questions or your comments. And a reminder that this is a listening session, not a technical assistance webinar. So we're primarily here not to answer questions, but to hear from you. We have some questions for you that we would like to hear your responses on. So with that, it's my pleasure to introduce our State Office of Rural Health Program Coordinator, Tiffany Frazier, who will be presenting today.
Thank you, Chris. Next slide. Hello, everyone. Thank you for joining us today. This is our fifth listening session. Many of you have been to the last four that we have, so we thank you for attending. And I also want to thank you for all your engagement that you have been doing throughout this entire process. We are on a very short time frame, but you guys have answered the call again and again. With the survey, you guys, we gave you a week and a half, but you guys came in, you showed us that you guys are engaged, and this is something that's really important to us in California. And it's not only important to us, but it's important to you too. So thank you, not only for the work that you do, but how engaged you are in this process. Um, so I'm going to start by giving an overview of the Rural Health Transformation Program before we go into the exact activity, the goal that we're talking about today. And I just want to start with the definition of giving you an overview of rural in California. So everyone thinks of California as not being a rural state, but in fact, we are a rural state. So 82% of California is an actual rural census tract, and over 2.7 million people live in those rural census tracts, and that's 7% of California's total population, but it's more than almost 20 states' total population. 57 of our 58 counties also have rural populations. So our rural populations are spread out, and they have many challenges that they have to face. Now, how they help face these challenges are with our rural health infrastructure right now. So we have 279 rural health clinics, 296 federally qualified health centers, and 76 rural hospitals. These are the current way that we serve our communities. And what we're trying to do now is transform how our rural providers and our rural customers receive their care. So also, I just want to make note that 70%, 76% of of rural census tracts are also located in a primary care health professional shortage area. And that goes to show just how significant the need is in California. Next slide, please. So, just doing a quick overview of the RHTP, which is the Rural Health Transformation Program. The overarching goal is supporting rural communities to improve healthcare access, quality, and outcomes through system transformation. So this is not meant to be a supplement for Medicaid or Medi-Cal. It's actually a great opportunity to transform the way care is brought to the communities. And we want to take this time just to not only keep what we're doing because we're already providing fantastic care and everything like that. But this is a great opportunity to move ourselves forward and to try different things that will innovate and transform rural healthcare. So the strategic goals that CMS has come up with are the first one, make rural America healthy again, which we're here today to talk about. So that's for expanding rural health innovations and access points to address root causes of disease. Um, the second one is sustainable access, strengthening rural health providers as long-term access points by improving efficiency, sustainability, and partnerships. Um, and also workforce development, where obviously, none of these things can happen if we don't have the workforce to do that. So we want to recruit and retain skilled providers, enabling them to practice at the top of their license and broaden the workforce with roles like community health workers, pharmacists, and patient navigators. Also, we have innovative care to advance new care models and payment mechanisms, and then tech innovation to support technology adoption for remote care, data sharing, cybersecurity, and emerging digital health tools. Next slide, please. So a little bit about the funding distribution. So this was a $50 billion over 5 years to all 50 states. So each state will receive um, okay, yeah, so every state is going to receive 100 million a year. And sorry, okay. So first, the funding is split up into two categories. So it's 25 billion that is going to be split evenly among all 50 states, and then 25 billion that will be a result of answers and that we put into our applications, including data-driven factors, initiative-based factors, and state policy actions. So with the 25 billion, each state will receive $100 million. And at this point, we don't know how much of the second half of the $25 billion dollars we would receive, but CMS has asked us to put a budget in for 200 million per year. But once we put in our application, they will then decide how much of that additional funding we will get. So we could get less than 200 million, or we could get more than 200 million, depending on how we answer the questions in the application. Okay, next slide, please. So, with the 5 goals, we have the 5 goals, and then using those 5 goals, we have to detail how we're going to make those 5 goals happen, and these are the 11 permissible uses of funds. Um, we must choose at least 3 of the listed areas, um, and CMS is going to be, uh, a very significant partner with these. So while we want to make sure that we um, do a robust and we put forth an innovative and well thought out application, we want to make sure that we don't stretch ourselves too thin because we will have to answer for these questions for these uses of funding at the end of the day. So we want to make sure that we are um, able to do all of the um, projects that we put forth and that we have the ability to make sure that that it can get done, or else CMS can and will pull some of that funding back from us. So for making rural America healthy again. At category A is the one we're talking about today, prevention and chronic disease. So the permissible uses of funds for that will be evidence-based intervention for prevention and chronic disease management. Next slide, please. So a little bit about the Rural Health Transformation Program timeline. So we received the application, the NOFO, the Notice of Funding Opportunity, September 15th, and it's due November 5th. So we are currently in our stakeholder engagement process, which included the survey that we're going to talk about in a moment, and also key stakeholder interviews. And again, I just want to say thank you guys for being very engaged and very active and responding in a timely manner to anything that we are asking you guys to do. So with this application, like I said, we're currently in stakeholder engagement, and after this week, stakeholder engagement will our initial stakeholder engagement will be done, but we will continue to have engagement throughout the 5-year period and throughout even with implementation. So I don't want you to feel like this is the last time that you can give input. This is just the planning phase. It's not a sprint, it's a marathon, and we are excited to work with you as our partners and our stakeholders in the upcoming years. Let's see. Anything else? We will the application. So the application's due November 5th. Once that application goes in, CMS may come back with questions, and they may ask us to, again, if we, once they decide how much funding we're going to receive, they will um, let us know how we need to update the budget and if we need to change some of our plans. So that will be going on all the way up until December 31st. And on December 31st, that's when the decisions will be made. And then 2026, it starts right away. So once we get the award and we find out what we are, so it's going to be boots on the ground, and we will be moving forward. Um, Next slide, please. Okay, making rural America healthy again. This is the first goal of CMS's application, and um, it's an important one. So this encompasses all of the things. This is mainly about um, whole whole person care and reducing sickness and health issues in rural communities. So the goal is about reversing the health decline in rural communities by addressing root causes of disease and improving access to care. So the focus areas are prevention. Obviously, we want to promote wellness and early intervention to reduce disease burden. Um, And then chronic disease management, we want to support evidence based programs for conditions like diabetes, hypertension, and heart disease, but also things like childhood asthma, obesity. These are things that we know that are issues in rural California, and those are the kind of programs that we want to put forward so that we can make sure that we are managing those chronic diseases. Behavioral health with expanding access to mental health and substance use disorder services, and prenatal and maternal care. So, improving outcomes for mothers and babies through better access and continuity of care. Um, Why does this matter? We all know that rural residents face higher rates of preventable illness and mortality, um, and many rural communities lack local access to behavioral health and prenatal services. The goal here is to support community based and culturally responsive care models that meet people where they are. Next slide, please. All right, so the survey. So we heard from over 350 stakeholders. We're very excited about the amount of people that took part into the survey and the type of providers that came. So we had over 57% of healthcare providers. Those include hospitals, 30 of which are critical access, federally qualified health centers, Indian health services, and mental health programs. And then we had also 43% of non-providers, which include county governments or departments, city or local governments, academic centers, philanthropic organizations, and health plans. So, thanks to everyone that took the time out of your day to fill out the survey. And this is what we heard from you. So, next slide, please. So, what are the most viable evidence based interventions for prevention and chronic disease management solutions? Integrated care, evidence based lifestyles, and behavioral interventions and models of care, expansion of primary care, care management, community health worker programs, and technology enabled solutions such as remote patient monitoring or digital coaching. Um, Technology enabled solutions such as remote patient monitoring or digital coaching, telehealth chronic disease visits, school based programs, and clinical pharmacological interventions. So, these are in order. So, the most important parts are integrated care and evidence based lifestyle and behavioral interventions and models of care. So, we would like to hear from you now about what what kind of interventions and what kind of models do you guys know about that we can invest in right now that for long term solutions in rural healthcare. Next slide, please. So some of the things that we heard on the survey for mobile and community-based care, mobile clinics, community health workers, home-based services, and outreach to underserved populations. We want to elevate primary care, so again, promote whole person integrated care, promote proactive population-focused strategies, and build resilient local healthcare systems. Um, for maternal and perinatal health, OBGYN provider recruitment. So workforce is always an issue. Also alternative birthing centers, regional and maternity partnerships, and telehealth prenatal and postnatal care. Um, for chronic disease management, it's going to be remote patient monitoring, lifestyle interventions, school-based health programs, and community-based prevention. And access barriers to healthcare are non-emergency transport, transit coordination, specialty care, and specialty care transportation. So for equity and community engagement, we have promotores, culturally appropriate care, bilingual providers, and community-based outreach. So obviously we're only getting, we don't know at this point what we're getting, but $200 million a year isn't going to go a long way to do all 5 of these activities, but we are making an effort to do as many as possible, um, to start the optimizing of rural healthcare and making rural America healthy. Next slide, please. So I've given you an overview kinda in, what making rural America healthy is again, and now we wanna kinda hear from you. We wanna talk to you about the strategies that, you guys have come up with to, um, to do these in your communities currently, and then we wanna talk about what things can we do in the future to make, these, to support the healthcare and the health management of all of these things. So the first question we have here are what are some strategies that would be helpful in preventing and managing chronic conditions such as diabetes, hypertension, or heart disease? And that is not all inclusive. So there are many other chronic conditions that we have in rural communities. So if you have ideas about other um, issues, please also let us know about those. We also wanna know what local programs, or partnerships would be effective in promoting health and wellness in rural communities, and how can, telehealth, mobile clinics, or digital tools play a stronger role in improving rural health outcomes, especially for primary care and chronic disease management? And finally, what resources would help rural communities better integrate behavioral health, nutrition, and preventive care with primary care services? So we want to give you some time. I see that we are getting some questions or some comments coming forward. So we'll give you a minute to do that. And then let's hear from Chris.
Thank you, Tiffany. As we move into the listening session portion of today's session, I want to remind you that this really is the heart of our conversation today. Again, if you want to participate with us, please use the Q&A button in the toolbar at the bottom of your screen, and you can type your answers to these 4 questions or any other questions that you may have, general comments as well. Just a reminder that this is a listening session. Our goal today is to gather your inputs. And one last reminder that some of the details of this program are still in development, so we don't have all of the information yet. So as we get started here, Tiffany, um, see that one of the questions or comments, I think it's a little bit of both. Is housing included as a factor of need in rural communities for workforce development? I know in our fire impacted communities, adequate housing stock for healthcare workers has been an issue in attraction and retention. And there's an answer in there, but I wonder if you wanted to speak to that just in general about where we're at and how that's going to work.
Yeah. So um, the social determinants of health are definitely on the forefront of all of our minds while we are creating the plan. I'm not going to speak to exact things in that we currently have in the plan, but we do understand that housing is a huge issue both for our residents and for our workforce. So that is something that um, is constantly in our conversations and something that will possibly play a role in what we do in the future with the RHTP.
Right. Let's see here. Uh, we've got Aggie Erickson says, given the focus on rural chronic disease management and maternal behavioral health, have you considered e-consults as a way to provide timely special input without requiring patients to travel?
Yes. Telehealth is going to play an important role in RHTP. This is like one of their main focuses about growing rural healthcare, and we do understand that transportation is an issue. So telehealth and figuring out how we can do telehealth effectively and safely is going to be a huge part of how we right size or not right size but optimize rural healthcare in the future. So thank you for that information.
Another one, is there any discussion about evidence-based policies that communities can adopt for prevention?
So yes, there's discussion, but we would like to hear from you. What are some of those policies that you would like to see adopted? What are some of those policies that you are hearing about? What are some of those policies that you think would work that we should move forward with? And then so this hopefully is an opportunity for you to tell us. This is yeah, obviously we're talking about them and that's going to be important part of we need data to back up what we're saying. We need evidence that these programs work. So if you guys not only have policies or programs that you are already doing, this is a way for us to increase the opportunities in those programs and and make the programs larger and more well-rounded.
All right, thank you, Tiffany. An anonymous comment question. I'm interested in exploring more peer education models. The local Ryan White program has had success for peer support. HIV management, local SUDS has also had similar success. Finally, most people are getting their info from social media, while experts are generally not trusted. Peer education models might help counter these challenges.
Yeah, thank you, Anonymous, for that comment. Um, yeah. Um, what one thing that we really did like about this NOFO is that they called out um, those kind of workers. They called out community health workers, peer education models, and things like that. So this is something that we had already started working on in California, and there have been talks about increasing those programs and increasing those partnerships, whether that's through programs, through education. Um, or many more things like that. So yes, community health workers and peer education models are going to be a very important part of the rural transformation program.
All right, thank you. Another anonymous uh, question comment. Early BH intervention is important for children and a way to reduce costs if services are provided early. Are telehealth interventions in schools um, something that can be included in the application? Oftentimes, more rural schools have trouble staffing and having the capacity to support providing services, and telehealth providers can help bridge that gap and get to children early.
Yeah, thank you. So we understand that health is only one part of the issues in rural California, and we are going to have to do where we are going to have to wait. We are going to have to find ways to partner with local programs, local schools, and many different partners that in order to come across different ideas and different services. So children are very important in rural communities, and we will be looking at ways that we can better integrate the behavioral health and different things within the application.
All right, another anonymous comment. Just wanted to share with telehealth and mobile clinics expanding internet infrastructure is criteria so providers can access cloud-based EHRs, deliver virtual care, and connect with patients via text messaging.
So sorry, Chris, is that a comment or a question? So
I think that's a comment more so.
okay, yeah. So yeah, EHR. The technology aspect is going to be integral part of the health future with the transformation aspect of that because um, if we don't move with the technology, of course, we're going to get left behind. So, most likely, a lot of a better portion of what we are doing with RHTP is going to be technology based, and making sure that that rural providers um, and patients have the resources that they need in order to make their hospitals and their clinics easier, healthcare management easier.
All right, thank you, Tiffany. Um, next one is another anonymous one. Our community has partnered with Blue Zones Project to help work on the 3450. I believe that's a three behaviors framework leads to four diseases that account for 50% of deaths. Um, Behaviors being tobacco, healthy eating, and exercise. Their initiatives help involve the whole community in these efforts.
Thank you for that information. So, um, those type of programs are going to be important. So, I just want to. Chris is going to make sure that you have this information later. But if you guys have projects and programs and proposals that you guys want us to take a closer look at, please send those. You can send those to calsor@hci.ca.gov. And we are in the process of reading your proposals and looking at them and seeing what is actually viable for us to do and what opportunities that we can take advantage of. So that sounds like a really good program.
Yeah, and the what Tiffany's referencing is for anybody who needs to send anything to us directly. Say you think tomorrow you realize, oh, I should have brought this up, and need a way to contact us. You can email us at calsor, which is CALSORH, at hci.ca.gov, and we'll get that information out again later. But it's a great way to include us in anything that you feel would be helpful for us. All right. Next one. To effectively approach in most chronic diseases, nutritionist counseling, telehealth would work well with obtaining support for patients. Also, a traveling nutritionist that can provide group hands-on food preparing and nutritional classes.
Yeah. So going out and seeing a bunch of the programs that you guys already have in rural communities is great. Like nutrition plays a huge role in promoting health and wellness everywhere, not just in rural communities, but those programs are going well in some communities, and RHTP is an opportunity to increase those increase those programs. So yes, nutrition based projects are going to be an important part of RHTP.
All right. Tina says, cute for question two, accountable communities for health or ACH could be a good resource to promote health and wellness in rural communities.
Um, I'm not familiar with ACH, but again, thank you for that information. We are looking at all of your information that you guys not only send here, but that you send us via email. So we are keeping all these projects in mind. And again, this is not the end of stakeholder engagement. This is only the beginning. So we will continue to learn about more of your projects and more of the things that you guys are doing. So again, thank you for all the information that you guys are providing.
Uh, Mary says cross-system collaboration is vital in rural communities. A policy encouraging sharing across funding lines and regulations would be very useful. Technical assistance in setting up such systems would be very helpful.
Yeah, and that's something, thank you, Mary. That is something that we'll definitely keep in mind. It is something that we have talked about and something that that we will be moving forward. So we do know that also with all of the things that we are trying to provide, technical assistance is going to be a huge part. We don't want to just start programs or start new um, technology benefits and then leave you guys out there on your own. This is something that we will work with. A huge part of RHTP is also sustainability. So this is something that we will continue to work with, especially here at the State Office of Rural Health. Um, we are going to play a huge part in the implementation of RHTP, but while RHTP is only 5 years, we will be continuing after that 5 years. So we definitely will be providing a lot of technical assistance for you guys, and we are always here to support.
All right, thank you, Tiffany. Neil Curran says, building on the success of the community support services offered through CalAIM is critical here. Many groups, such as ours, have built robust programs currently serving rural Californians. It would be helpful to transition the delivery of these services to flow through rural providers slash rural clinics, etc. Additional funding and flexibility would allow us to improve services and increase the impact of those programs.
Yeah, great call out. Thank you for that. That is something that we already know. We already have in HCAI, we have a robust amount of programs here that have proven success. And yes, those will be a lot of the programs that we will be continuing with and working on. So those are programs are only going to help us improve our application because we know that they have success, and we will be looking to continue and enlarge those programs. So thank you for the information about how we can um, make that even better.
Great. Let's see here. I had a question again on that uh, email address, and we're going to answer that in the Q&A here, but I'll say it again. It is CalSOR, CALSORH at hchi.ca.gov, and you see that in the answered questions here. All right, let's see here.
I see one comment here where it talks about where in regions like ours where fresh food is grown but rarely stays local. Um, that's an important distinction. So in rural healthcare, we do know that we support most of the country with the food that we create here, but we still have food insecurities and food insecurities in those rural communities. So while I can't say right now specific programs and specific specific things that we will be doing, those are things that we have conversations about regularly, and that's something that we will be working on in our applications.
Excellent. Thank you. Well, we really appreciate everybody's participation with us today. Um, we would love to continue the conversation, and we do have time. So please continue your feedback on these 4 questions and anything else you think would be relevant for us to hear. Do want to mention that our cutoff for feedback proposals is by the end of today. While we still can accept things later than that, we do have a very tight time frame for everything going on, and so we really need any proposals you have by end of day today to be able to effectively incorporate that into the plan. So we appreciate everybody who's already submitted proposals and look forward to any others that we might get today. Um,
Yeah.
all
And thank you, Chris. I do want to reiterate too, yeah, that um we still have a little bit of time now, but yes, we're asking end of day right now. We're going to be moving into our writing phase. So the stakeholder engagement part, as I said, it's going to continue. So um you will be hearing from us in the future. So we will, certain key stakeholders, we may be reaching out to you, or we will be having more opportunities like a listening session, not necessarily specifically like this, but we will continue to engage our stakeholders and our partners in order to successfully integrate the management.
right. And proposals, they should send those to the CalSOR email address, correct, Tiffany?
Yes, continue to send that to the counselor, and somebody just asked about proposals fleshed out or potential ideas. While yes, we love all your ideas, but and we love to hear about them because we will work out opportunities there. But if you have proposals or you guys have ideas that are fully fleshed out, those help us because again, we are on a short time frame. So we have to we got this application September 15th, and we basically have a month when we're closing to the end of that month where before we have to say we it has to leave our office and it has to move on for additional approvals and everything. So that's basically 1 month to get all of that information in and able to be part of the plan.
All right. Thank you, Tiffany. And we really do appreciate everybody's participation with us today. Uh, this is your thoughtful participation really does mean a lot to us, and thank you, Tiffany, for bringing your expertise and our subject matter expert team helping us answer. We do appreciate everybody's participation today. I want to note that we've captured all of your questions, all of your comments, everything that you submitted to us today. We have captured all of that, even if you didn't see it answered publicly, even if we didn't speak to it. We have captured everything, and we're taking it all into consideration. And so we do really appreciate that participation with us. Again, please get your feedback to us by the end of the day at calsor@hci.ca.gov. And the reason why we're doing this is because your feedback is an essential part of shaping California's plan for the Rural Health Transformation Program. Before you go today, we want to encourage you to visit our website for resources and updates. It's a great way to stay aware of everything that HCAI has to offer. And we can go to the next slide. We also would love for you to stay current with us on our social media accounts, and you can follow along on any one of these social media platforms. We would also love for you to tag us in anything great that you're doing to help keep California healthy. You can tag us with any of these hashtags down at the bottom of the page there. One of the great ways that you can stay current with health workforce efforts is on the next slide. You can go ahead and subscribe to our monthly newsletter for Health Workforce and go to this URL, or you can go to our webpage and hit the subscribe button at the top. And just make sure that you select any one of the categories under the Health Workforce section, and you will be added onto our monthly list and will be up to date on everything that we have going on. You can contact us using this phone number, or again at that email, calsor@hci.ca.gov. You can see its full spelling there on the screen. And we do appreciate you staying engaged with us as we move forward. So this does conclude session 5, Making Rural America Healthy Again. This is the last of our RHTP listening sessions. Thank you again for joining us. We look forward to continuing the conversation as this effort takes shape. With that, we do conclude. Thank you and have a wonderful day.
Thank you.